It is day 4 since I had my surgery. First of all, my hair is growing back. I'm seeing some little things coming up. So, hair's growing back. That's the good news, at least for me. It's coming back different. I do see it a little curly-ish, and I didn't realize how much gray I had, but hey, that's wisdom. Okay, so I have gloves on because I'm going to change my these little bulbs that collect fluid. So just to show what it looks like, my friend gave me this pillow. Shout out to Annie. Thank you so much. I use it when I'm sleeping. So I just collect I have 4 of them because it's 2 on each side. The drainage bulbs. And then, I have to keep track and share with my surgeon for when I go back in a week from today. So he knows how much each side is draining. So he labeled them. So that's 1, 2 here, and then I have 3 and 4 here. And so I keep a log. This is an example of how the log looks like. So I put the daytime and then each of these little tube thingies, and then how much I'm draining at each time. So that's how it looks like. I'm wearing this vest that they gave me, this bandage thing wrapped around to kind of help hold everything together and help me heal well. So I have this. I've ordered another one so I can change them out. And then once again, Annie, thank you, gave me this shirt, which is really nice because it has these little pockets inside where I can put the bulbs when I'm walking around, because it's kind of hard to move around with them. In terms of Antiquilla, my neighbor also gave me the little one that is like a lanyard type. You put it around your neck and you put them in there. So they've been really helpful in terms of walking around with these things. I walk like I have appendages on me. So far I've been okay. My mom and auntie left yesterday, so there's a little bit of that emptiness, but thankfully Malta is still here and she's been a great help. Like right now she's helping me with the kids. They just woke up. And so I still have pain. I'm still kind of slouched over. If I stand tall, it hurts. I still have pain. I'm trying to wean myself off of the Oxycontin, but it's taking a little while because I am having some serious pain. I would say it ranges from 6 to 7 when I take the medication. That's when I take the medication. In terms of the pain, from 1 to 10 is about 6 or 7. What else? I'm eating normally, so that's fine. And sleeping, the medication does make me sleepy, but I also meant to say that the medication is making me itchy. They gave me morphine in the hospital. That was making me itchy, but so is this Percocet. It's making me itchy as well. Like when I take it, I get itchy. So I have to get the Benadryl lotion. I'm going to get that today to kind of, the Benadryl rub to kind of help with that. But the itchiness kind of goes away after a while. It's just after I take it, within 30 minutes, I start getting itchy a little bit. So yeah, that's what's going on. I'm going to turn off because I'm in pain right now. And I'm going to drain these little things, the bulbs. And then I will share that with my surgeon when we meet again. So I'm just going to walk through how I do the emptying the drains. They told me that they would have someone come help me, but I figured it out. And, my husband's a nurse and he's been helping me, but I figured out how to do it. But you can see that they have different colors and they're releasing different amounts of fluid. Interestingly, this is number 3. It has had the most. It has had 60 milliliters, 30, 40. This number 4 has been low. It's been actually the lowest. And it's interesting, the color is different too. Of the fluid. I think the color indicates how much fluid, how old the wound may be, I guess. At least from my thinking. I haven't looked it up, but from my thinking, I know that when the color changes, it becomes less oxygenated, right? So the color does not look as deep red as when it's fresh. So you can see I have different levels here. So what I normally do is I have to open. So this is number 1. I have to open it. It's kind of hard because I'm using the other hand to hold the camera, but I'm sorry if it's gross. I'm just whoever this may help. And then I pour it to empty it. It's now at 40 milliliters. So I empty it in the cup, and then I push in like this to allow for more to be suctioned out. So it has to be pushed in, and then I close it and throw, oops, gotta push it in all the way. So they said that this, depending on how much is being taken out, the first post-op visit, I'll take out some, and then the second, and then like a week or two later, I take out the others. So it's gonna be about 3 weeks or so to remove this, 3 or 4 weeks to remove these bulbs from my chest, this drainage bulb. So then I just throw this in the trash, sorry, not in the trash, in the toilet, flush it, and then continue on. So I'm going to label it. Can't do that while I'm holding the video, but I'm going to label it here, put the date, I'll put the time, and how much I've been able to collect for number 1. Mobility wise, I can barely move this arm, and this is the, you know, the side where I had the cancer. So they took out 2 layers of lymph nodes from here, and it's really hard to, like, this is my full range of motion right here, at about 40-degree angle. And then on this side, I can move a little bit more, but I can't keep them up for long, obviously. It's just been a few days. My biggest concern is lymphedema, so they have scheduled for physical therapy, and I'm going to take advantage of that to just help me learn how to move my arms and do what I have to do to avoid lymphedema as much as possible. My problem is that I do not know how to be still. Like, I sit down and I get tired of sitting down. So I try to get up, and I need to just force myself to just be in one place and let the healing take place, because I want this to close well. But it's been hard to keep, I'm not kidding, to try and just be in one place. Been hard.